I had to sit down in a chair, and all of a sudden I just slid out of the chair on the floor. I knew I was falling. I thought, how am I going to get up?
I found out my mom had a stroke. I was very scared. When I got to the hospital, she was in the ER, and her right side was paralyzed, and she couldn't speak. She couldn't move her arm or anything.
A stroke comes in many varieties, but in her case, she had a blood clot that traveled up her arteries and lodged in the artery that feeds the entire left side of her brain.
The doctor said that since she was on blood thinner that they couldn't do the clot buster, but that they could do this new procedure, I think it was called a solitaire, and go in and try to remove the clot.
Solitaire is a device that kind of looks like a small stent, and we put it in through a tiny catheter that we access the artery in your groin and take it all the way to your brain. We deploy this little stent-like device in the artery that is occluded by the clot. And once it sits there for a few minutes, we can pull the entire device back and the clot comes out with it. So it's a clot retriever device.
Basically, they just went in and destroyed the clot that caused my stroke, and then I was okay.
It went very well. She came in, and within 5 minutes we were in place inside her brain. 5 minutes later, the clot was removed. The next day, she had no residual symptoms from her stroke.
When she came out from the procedure, she could move her arm, she could talk. It was just the difference night and day.
I think she's very fortunate. This procedure is only offered at Sparks in this area. And when you're talking about ischemic stroke or stroke of her kind, every minute counts, which means every minute a few million brain cells die. She really couldn't have been sent to Little Rock or Tulsa. She needed treatment immediately. By the time someone hits the door and we identify that there's a stroke, we can be in place inside their brain in about 10 minutes.
It was a miracle that I got over there in time. I had heard about this other procedure, and I knew that Dr. Wood was the only one in Fort Smith that does it. So I was real fortunate that he was there.
One of the most rewarding things, I think, probably in medicine, to watch a patient that has had a major stroke and that you know will either die or be severely disabled the rest of their life, wake up on your table like nothing ever happened.
Maybe I could have been alive, but I would have been really paralyzed and not been able to walk at all. Absolutely excellent care at Sparks. Oh, I feel wonderful. I feel like they saved my life.